Fracture. A fracture means a break in the continuity of the bond. So, in this picture, you can see that a break in the continuity of the bond. Okay, that is known as the fracture. There are lot of classification is present for the fracture. We can see the classification of the fracture one by one. Type of fractures based on characteristics. The first one, avulsion. Avulsion means it's a fracture of bone resulting from the strong pulling effect of tendons or ligaments at the bone attachment. So, avulsion fracture mainly due to the strong pulling effect of tendon or ligament, the bone will be fractured. So, that is known as the avulsion fracture. Next one, comminuted fracture. Comminuted fracture is the fracture with more than two fragments. The smaller fragments appears to be floating. So in comminuted fracture, there will be more than two fragments and the smaller fragments will be floating in the comminuted fracture. Next one, displaced or overriding fracture. That involves displaced fracture fragment that is overriding the other bone fragment. The periosteum is disrupted on both sides. So displaced fracture means the fracture bone is displaced from the site of origin. That's why the periosteum will be disrupted here. Next one, longitudinal fracture. Longitudinal fracture is an incomplete fracture in which the fracture line runs along the longitudinal axis of the bone. So, longitudinal fracture means the fracture that occurs on the longitudinal line and it is an incomplete fracture, mostly hairline fracture. Next one, oblique fracture. Oblique fracture is the fracture in which the line of fracture extends in an oblique direction. So, the oblique fracture means the fracture that occurs in oblique direction is known as the oblique fracture. Next one, pathologic fracture. Pathologic fracture is the spontaneous fracture at the site of bone disease. For example, if the patient have cancer or if the patient have osteoporosis or any bone infection that may cause spontaneous fracture of the bone. That is known as the pathologic fracture. Next one, green stick fracture. Green stick fracture is an incomplete fracture with one side splintered and the other side bent. So in this picture you can see that there is a disruption in the one side of the bone and the other side is normal. So that is known as the green stick fracture. Usually one side will be bent and other side will be splintered. Next one, impacted fracture. Impacted fracture is a comminuted fracture in which more than two fragments are driven to each other. So, impacted fracture is a type of comminuted fracture, but here the bone fragments impacted each other. Next one, interarticular fracture is a fracture extending to the articular surface of the bone. So, interarticular fracture, especially the joint fracture, here the fracture extends to the joint area, that is known as interarticular fracture. Next one, spiral fracture. Spiral fracture is the fracture in which the line of the fracture extends in a spiral direction along the shaft of the bone. So, spiral fracture usually occurs along the shaft of the bone. So, the fracture extends in a spiral direction. That's why it is spiral fracture. Next one, stress fracture. stress fracture that occurs in normal or abnormal bone that is subjected to repeated stress such as running, jogging, etc. So, due to repeated stress, there will be a fracture that is known as the stress fracture. Next one, transverse fracture. Transverse fracture is the fracture in which line of fracture extends across the bone shaft at a right angle to the longitudinal axis. So, transverse fracture is the fracture in a transverse direction. Okay, so this is the first classification of the fracture. Next one, based on the communication or non-communication with the external environment. So, second type of fracture classification, that is based on the communication or non-communication with the external environment. So, that is classified as simple or closed fracture, compound or open fracture. Simple or closed fracture means the fracture is not communicating with the external environment. But compound fracture or the open fracture means there is a communication of fracture through the skin with the external environment. So in the picture you can see that compound fracture is extends through the skin and it is communicating with the external environment. Next fracture, that is based on anatomic location of fracture. So in this there is the fracture site is proximal third, middle third and distal third. So based on the anatomic location of the fracture involved in the bone, it is divided into proximal third fracture, middle third fracture and distal third fracture. Next classification is based on stability of the fracture. There are stable fracture and the unstable fracture. Stable fracture occurs when a piece of periosteum is intact across the fracture and either external or internal fixation is possible here. So stable fracture means periosteum will be normally intact and it is mostly undisplaced fracture. Unstable fracture, that is grossly displaced during injury, especially the comminuted fracture or the oblique fracture. Very difficult to fix this fracture, that is known as the unstable fracture, grossly displaced fracture during injury. The examples are comminuted fracture and the oblique fractures. So these are the classification of fracture based on characteristics, based on communication with the environment and also with the based on anatomic location of the fracture and based on stability. Thank you.